Good afternoon to everyone. Welcome to the Symposium Consensus Document Actualization of Frailty Prevention in the Older Person, endorsed by the Minister of Health in Spain. My name is Alvaro HERRERO. I'm a geriatrician. I work as a head of section in geriatric medicine at the University Hospital of Navarra. First of all, I want to thanks to the International Association Gerontology and Geriatrics, all the Argentina organizers and friends, and finally all the assistants to this meeting. This first consensus document of frailty prevention in Spain was published in 2014, and it was a very relevant document for geriatricians and health managers and policymakers. After that, the Minister of Health, and together with all scientific societies, as the Spanish Society of Geriatric Medicine and other relevant scientific society, updated these documents. And that's the one that we are going to present today. This is the first time that this document is going to be presented. We believe that is going to be very relevant. As you all know, we are in the healthy aging decade, so all the strategies relating with frailty prevention are very, very related with healthy aging promotion. So I think it's going to be very interesting and very relevant for this meeting. For this symposium, we are very honored that we have three very relevant experts in this topic. First of all, I have the honor to present you Soledad JUSTO. She is the head of prevention area of the General Subdirector of Health Promotion and Prevention at the General Director of Public Health at the Ministry of Health in Spain. She is a specialist in internal medicine and preventive medicine and public health. She has a master in preventive medicine and public health, and she coordinates the prevention, frailty, and fast working work of the health prevention and promotion strategy of the national health system in Spain. And her area of research is healthy aging promotion and frailty and aging prevention. She's going to talk about this document, the consensus document, actualization and frailty prevention in the older person, representing the Ministry of Health in Spain.
Good afternoon. I'm going to talk about the update of the consensus document on frailty prevention among the elderly in Spain. Frailty is a public health priority in Spain because it's a very good predictor of disability and death, even more than multimorbidity. It is a common condition in Spain. 18 of people over 65 years old are frail, varying from 12% in the community to 45% in primary healthcare settings. It is associated with age, and Spain is one of the countries with the longest lifespan in the world. But it is not the same with the healthy life expectancy. It is preventable, detectable, and treatable. It is important to note that Spain is a decentralized country in some aspects. Most of the health competencies are in charge of the regions and municipalities, but the ministry is in charge of foreign health care. Legislation on pharmaceutical products and general coordination of the health system. Related to general coordination, there is a coordinated body called the Interterritorial Board of the National Health System, which guarantees the coordination and standardization of the health-related actions at regional and national level. In 2013, this Interterritorial Board approved the strategy for addressing chronicity in the National Health Service, to address the increased prevalence of non-communicable diseases and their main risk factors. Within this framework, the prevention and health promotion strategy of the Spanish National Health System was approved, with the aim of promoting the health and well-being of the population by fostering healthy environments and lifestyles and the strengthening of safety to prevent injuries through the progressive development of interventions aimed at improving health and preventing illnesses, injury, and disabilities. This strategy is developed in a three-dimensional course of action by populations, environments, and paths to address. The health promotion and prevention strategy has 5 specific objectives and interventions selected for action associated. The last two related to the promotion of healthy aging and the prevention of frailty. One is to develop a comprehensive counseling in lifestyles in primary healthcare linked to community resources and the adult population. And the other, which leads us to here, is to develop a frailty screening and preventive intervention in the elderly, which will lead to individualized plans. In charge of carrying out this intervention, the Frailty and Falls Working Group was created in 2014, formed today by all the Spanish regions and some professional associations. In 2014, the consensus document on frailty and falls prevention in the elderly was approved by the Interterritorial Board, and other supporting documents related to how to develop a multi-component exercise program in the community and how to improve the record of frailty in the clinical history were developed. In 2019, the roadmap to address frailty, and in 2021, an adaptation to the COVID-19 situation were approved by the Public Health Commission. The update of the consensus document was recently being developed in order to include the latest available evidence. The consensus document on the prevention of frailty and falls developed a program to detect the frail elderly and provide the appropriate intervention. On the left side of the screen, you can see the 2014 algorithm, and on the right side, the new one. That is what we are going to talk about. The main setting for developing this program is primary care. The program is proposed as a first step for this. The program proposed as first step for the selection of the population that can benefit for this intervention to make a Bartel index. Those people with less than 90 points are not selected for this program because they can benefit from other programs on disability or morbidity, for example. Then early recognition of frailty is proposed through performance tests such as SPPB, gait speed, or TUG, or through the frail index when face-to-face attendance is not possible, as occurred during the COVID-19 restrictions. The natural step should be a diagnostic test, but in our country, frailty diagnostic tests such as FRED or FTS5 are not being used in primary care healthcare settings. Nowadays, we set up intervention based upon high suspicion of frailty. Therefore, it is a future goal for Spain to base our intervention on frailty diagnostic tests. The next step is to develop comprehensive geriatric assessment with a care plan and individualized intervention prescriptions based on multi-component exercise program, for example, we will frail program, nutritional assessment and recommendations, medical review, and other interventions with evidence in addressing frailty. Criteria have been established on when to refer to other care levels, such as the hospital or social care. As a novelty, with respect to the previous document, some recommendations are presented for early recognition of frailty in hospital and community settings, with referral to primary care in the last case. The previous consensus is available in English on the website, and the update will be available soon. There will be supporting materials such as brochures or videos on the websites. The Spanish Ministry of Health has a Healthy Lifestyles website to promote healthy lifestyle, including healthy aging. In the last evaluation of the previous consensus carried out in 2019, all the regions have initiated some action to include this program in their strategies, programs or actions, but with very regular results. At least 4 regions have implemented the complete algorithm and were carrying it out. At least 4 regions have included it in the portfolio services, and 4 had an advanced project ready for inclusion in the portfolio as soon as possible. In all of them, including those that have not yet started implementation, the outbreak of the COVID-19 pandemic has been a significant barrier to further progress. It is a challenge for us to continue with this process and achieve the goal by 2025. Almost 80% of the regions will have implemented the program. Marianela BAYÓN will speak to us later about the implementation of the program in the Community of Madrid as a representation. Thank you very much. To conclude, just saying that in 2019, the working group developed the Spanish roadmap to address frailty within the framework of advantage joint action. It was approved by the Public Health Commission, and it is the map that will guide us for future steps. Cristina ALONSO will tell us more about it in the next presentation. Thank you very much for your attention.
Finally, I have the honor to present you Marianela BAYÓN CABEZA. She's a family and community nurse. She's the technical responsibility of primary care management service portfolio in Madrid Health Service. She has a master's degree in care research and a master in care quality and patient care. She has also a higher level degree in clinical research methodology, and she's going to talk about the practical experience in Madrid region. So I think that is going to be a really ending point for a practical implementation of this strategy.
Good afternoon. I would like to share with you our 5-year experience working in the care of the elderly in the primary healthcare of the Community of Madrid in Spain. Spain is divided into 17 autonomous communities and 50 provinces. Each autonomous communities is a territorial entity with legislative, executive, and administrative powers in different public services. One of them is the health system. The Community of Madrid is an autonomous community and also a province. Primary health care is a part of the public health system and gives service to around 6.7 million people. Among this population, more than 900,000 people are 70 years old or older. Primary health care of Madrid is composed of 262 primary health centers and 160 rural local clinics. The system counts with more than 13,000 professionals. In 2014, 2 strategies came out in the form of documents that represented a change to the regular healthcare until that moment. One was the consensus document about prevention of frailty and falls in elderly, coming from Ministry's Health Promotion and Prevention Strategy. Its purpose was to maintain the autonomy of the elderly, identify frailty and high fall risk, and also reverse and delay functional decline. The other was the care strategy for patients with chronic diseases in the Community of Madrid, which stratified a chronic population into 3 intervention levels, low, medium, and high, in order to delay disease progression, reduce complications, and improve the quality of life of chronic patients and their caregivers. In 2018, appeared a new version of the Madrid Primary Care Standardized Services Portfolio, which implements both strategies by developing specific health services for chronic patients in relation to intervention levels and functional capacities. Service Portfolio is a document that includes 40 prioritized services made up of interventions with scientific evidence, whose objective is either to prevent or to treat a health problem. Services are provided by family doctors, pediatricians, nurses, social workers, and so on. They are structured in process indicators, 1 coverage indicator and some quality indicators called good care criteria or GCC. Interventions are recorded in the electronic health record. The registered information is annually evaluated with a structured query language. One of the main achievements of our portfolio is the creation of a new service called Care Service for the Elderly with Frailty or with Functional Limitation. This service brings together 3 ones that existed already. It is aligned with the objectives and actions of the ministry documents. The new service was developed by a multidisciplinary group that worked for a year reviewing the evidence and the previous documents. The new service implementation started in 2018 with the addition of the new version of services portfolio and the performance of several informative and training activities. This service is structured in 8 indicators, 1 coverage indicator, and 7 good care criteria. I'm going to explain them next and show the most relevant results for the last 4 years. Coverage indicator refers to the number of people who meet inclusion criteria compared to whole people likely to receive the service. In this case, people with 70 years or over. Inclusion criteria are based on functional capacity screening. They are evaluated by the Bartel Index for basic activities of daily living. The periodicity depends on elderly age, as you can see in the slide. Here, we have the results of the coverage indicator in relative and absolute frequencies. In the second graph, you can see the evolution of the target population values in black and the screened people in red. While target population remains stable for years, the screened people increase in the second year of implementation. However, they decrease during the last 2 years because regular healthcare practices had to be reorganized due to COVID pandemic. Bartel Index values help us stratifying population in different functional capacity degrees: independent people, low, moderate, severe, or total dependency people. This stratification helps professionals assigning a different care plan for each situation. Here is the flowchart that summarizes all the interventions and care plans included in the service and groups them into the 8 indicators conforming the service structure. I'm going to use this flowchart to explain the results of the different indicators, which are those ones marked in blue. First, we focus on independent or low dependency people. To them, we do the frailty and fall risk screening. This is the good care criterion number 1. The recommended scales for frailty screening are the short physical performance battery as first option. However, if the functional test cannot be performed for lack of space, the frail scale can be applied. The recommended scales for fall risk screening are the 3 questions proposed by Ministry of Health as first option, and then the Downton scale. This slide shows the GCC1 indicator results in absolute frequencies. The amount of independent or low dependency people is in light gray and the screened people in orange. We can see that the first 2 years, both values increase. However, in 22, the values clearly decreased, again due to pandemic. Another relevant intervention in our service is the initial geriatric comprehensive assessment represented by GCC3. In this case, we use Marjorie Gordon's functional health patterns as a guide. Here you can see the results in yellow, which follow the same trend as the other indicators. In this slide, you can see the care plan for frailty or high fall risk elderly in detail that professionals have to carry out every 6 months and which is represented by GCC4. Its objective is to reverse frailty. It consists in an assessment of self-care ability, nutritional habits, physical activity habits, functional capacity, frailty and fall risk screening, and social family risk. It also includes medication review, adherence to therapeutic plan, and some advices on healthy diet, multi-component exercise program, how to avoid falls, and how to maintain social relationships and intellectual activity. Multi-component exercise program is one of the most important interventions to reverse frailty. It consists of strength, endurance, and balance training activities. Services portfolio offers tools to help professionals to implement it, such as this summary table or several web pages. This slide shows the GCC4 indicator values. The amount of frailty or height for risk elderly is in brown, and the people with care plan done in green. We can see that in the second year, both values increased. However, in 2020, both decreased, again due to pandemic. This slide shows GCC5 and 6 results. They represent the annual care plan for moderate dependency elderly in bar chart above, and the quarterly care plan for severe or total dependency people in bar chart below. We can see again that both follow the same trend as the other indicators. As summary of this presentation, we can say that indicators show that there was a significant activity increase 1 year after implementation, showing a good reception of the new service by care professionals. However, in 2020, an important reorganization had to be done in primary care centers due to the COVID pandemic. This situation caused a decrease in care for the elderly and chronic patients. So for this reason, Madrid Primary Care Management is developing a plan to solve this situation since March 2022. The improvement plan is focused on reinforcing functional capacity screening, frailty and fall risk screening, and also the implementation of the care plan for frailty and fall risk. For achieving this, we have created a multidisciplinary group, working group that have promoted the active recruitment by sending lists of non-screened people to care professionals. We also have updated the registration forms in order to adapt them to the specific service intervention. In this slide, you can see a people list example, and in this one, a registration form example. We are currently reevaluating the service indicators to determine the impact of improvement actions, and we really expect positive results. In 2023, we will review and update the service according to new ministry consensus document and other evidences. Thank you very much for your attention.
I have the honor to present you Cristina Alonso. She's a geriatrician working at the University Hospital of Getafe in Madrid. She has worked very recently as one of the main coordinators in the Advantage European Joint Action strategy. This strategy is one of the first strategies that summarize the current state of art of different components on frailty and its management. So she has also has been working with the Pan American Health Organization, and actually she's the president of the Spanish Society of Geriatric Medicine. She's a really expert in frailty, and I believe that is going to be a really interesting topic. She's going to talk about the roadmap to frailty approach. She's going to summarize of the work of group of frailty and falls, the Advantage Joint Action, and the work of the Spanish Society of Geriatric Medicine.
Good afternoon. Thank you so much, Alvaro, for your nice presentation. And thank you to everyone joining us today here to know more about what we are doing to enhance healthy aging. On my own behalf and on behalf of the Advantage Joint Action and the Spanish Society of Geriatric Medicine, thank you to the organization for the opportunity of being here today presenting our work. Soledad has talked about the National Consensus Document on Frailty Prevention and also some actions that are being developed by the Spanish Public Health Department. Marianela has talked about the experience of Madrid. After that great introduction, I am going to deepen our national roadmap to enhance healthy aging and addressing frailty. The Spanish roadmap to address frailty was promoted by Advantage Joint Action. It was developed by the Working Group on Frailty and Falls that is led by the Public Health Department within the strategy named Prevention and Health Promotion Strategy of the Spanish National Health Service in collaboration with Advantage. It was approved by the Public Health Commission in November 2019. But what is Advantage? Advantage is a joint action that is a grant, a public source, for actions co-financed by the European Commission and member states or other countries participating in the action, to allow nominated authorities to take forward work on jointly identified issues that have a clear added value for the European Union under the European Health Programme. Advantage was the first joint action to promote healthy aging. The Advantage joint action is known as a comprehensive approach to promote a disability-free advanced age in Europe. It was funded under the 2015 call of the Third European Health Programme of the European Union, but also by the 22 member states involved. It has been led by the Health Ministry of Spain for 3 years, and it has brought together 34 partners, governmental and non-governmental institutions. The main goal of this joint action was to build a common understanding on frailty to be used in the member states as a basis for a common approach to manage older people who have or are at risk of developing frailty, all to promote a disability-free advanced age in Europe and to enhance healthy aging. That meant, 1, to promote important sustainable changes in the organization and implementation of care in the health and social systems. 2, to develop a common strategy to address frailty, including raising awareness and advocacy. And 3, to support to the member states to develop their own roadmaps to promote healthy aging. With all this, the main task through the life of the project was to increase the knowledge and awareness in aging and also in frailty. The other tasks were structured in 3 different phases. The first phase was to develop systematic reviews of the research literature, publications, studies about frailty, as well as a scan of the European Union, funded research projects, good practices, and grey literature documents from participating member states. The information is included in the state-of-the-art report on frailty document, which provides an overview of evidence on what works and what does not work in relation to the prevention and management of frailty. The state-of-the-art was released in December 2017 and updated in 2018. The state-of-the-art is an updated theoretical basis to inform our subsequent work. In a second phase, the partners collected information about the different approaches, strategies, policies, programs, actions related to frailty in the participating member states and their regions using a specific survey targeting key informants. This table summarizes the results. Please see that the use of the different colors is to show the level of implementation. The intention is not to see in detail this table. My intention is to point out that it's clear that all member states have already started to implement health policies that address demographic change and healthy aging. But this has generally been done in a heterogeneous way, achieving different results. Examples range from the development of whole system models of integrated care for older people to localized programs that focus on some of the many components of frailty. Most of the member states show a mixed picture, confirming that there is a room for improvement in all of them. That is why in the next phase, each member state was asked to develop a roadmap of actions for the next years to enhance the promotion of healthy aging and address frailty, considering their baseline situation and circumstances and using the state-of-the-art as the gold standard. At the same time, an open discussion was being developed within the members of the joint action, based on the previous work in order to the main recommendations of Advantage. These recommendations recommendations have been set out as 10 domains. Each of them includes a brief rationale, recommended actions, possible indicators, and is illustrated by a case study example. The document is entitled Promoting Healthy Aging Through a Frailty Prevention Approach and includes the advantage recommendations, but also the 22 roadmaps to enhance the implementation of these recommendations in the 22 involved member states. The advantage recommendations are the first evidence-based guidelines to develop public health in healthy aging and frailty. These recommendations can be applied in any country or region. And what with Spain? Spain had some work already done, but we saw great potential and some areas that could improve. Since the beginning, the Public Health Department was strongly involved in the roadmap development, what sustains the idea that there is more work ahead. The Spanish roadmap shares the same vision that other roadmaps that follow these 4 main lines to tackle frailty. First, pursue a health in all policies, healthy aging in all policies approach. Second, frailty actions should enhance synergies with other existing programs. Third, all actions must be evidence-based. And lastly, frailty interventions must be tailored to member states' needs and circumstances. The roadmap includes 6 priorities areas that are: make frailty a public health priority, promote the management of frailty at the population level, but also at the individual level, to establish and continually improve an integrated and coordinated model of care that addresses frailty, sustainable provide a well-trained workforce of professionals, and strengthen research capacity in aging and frailty. Each of these actions include specific activities. These actions and activities are the commitment of the Spanish government to enhance healthy aging in the coming years. More information about the roadmap and the activities in detail can be found in this article and also in the Ministry webpage. And if you need, please don't hesitate to contact me at my email. Thank you very much.
So thank you very much, all the speakers, for these really interesting topics and these very nice talks. And now we have time for questions and debate. Good afternoon. Thank you again to all the presenters for these very nice and excellent talks. I will start with the questions to the presenters. First of all, to Soledad, Dr. Soledad Justo, you have talked about this new version of the Spanish frailty document. Can you talk us a little bit more about what are the next steps in terms of frailty prevention in Spain? Thank you very much.
Thank you, Alvaro. Welcome, everybody. And yes, we plan to continue with the implementation of the roadmap that Cristina has presented to all of us. We have a lot of actions to do in the future, and one of them, for example, is the update of the fall prevention recommendations, because in the previous document we had recommendations for frailty prevention and falls prevention, but in this update we have only made the part of the frailty, and we have to update the falls prevention. And we intend to develop some meetings I expect in the last quarter of this year with public health and healthcare and portfolio services, in order to evaluate in each region
some facilities or some barriers to implement this program, because we know it is not an easy task, and we see it because of all the 17 regions in Spain, only 4 of them has it implemented already. No, so we know it's necessary to do a work in that way, and this is a resume of the next steps.
Thank you very much, Soledad. And the next question will be for Cristina, Dr. Cristina Alonso. You have talked about this very important European strategy that is Advantage. We know that this strategy has already finished a couple of years ago in 2019. What about next steps? What is plan? Do we have a plan after all this important strategy?
In public health, 3 years is a very short time, so it's a pity Advantage was finished just at the beginning of our way. So we are really sad about it, and we are working on getting more funds to get a second part of Advantage. Mainly, that will be a great opportunity for, I think, 2 main goals. Firstly, to facilitate the implementation of our recommendations, and also to monitor the real changes of Advantage in the countries.
Okay, thank you very much. What about the inheritance of Advantage in other countries? I mean, is there any? What was the main message of Advantages in other countries?
The heritage of Advantage is really heterogeneous across Europe, because each country is so different to the other ones, and the development and implementation of frailty strategies was really different. Summarizing, each member state has its own roadmap, and in at least 8 countries, the politics were changed thanks to Advantage. And the real change was also made in the awareness across Europe.
Okay, thank you very much, Cristina. Let's talk maybe to this question to Soledad. Let's talk about all the professionals, the health professionals, and how they are going to implement in real life this new version of this document. How it's going to be the training or the capacitation of these professionals in terms of this new document?
We have an online course about the program about frailty prevention for healthcare professionals, mainly medical doctors and nurses, but other professionals like social workers too. And it is a free course. It's certificated, and it's facilitated by an online platform, and we offer it to the regions, and they can offer the course to their professionals. The material was developed by 2 members of the working group, and now we are updating it with the new document and the new evidence, and we expect to have a new edition at the end of the year, more or less. And we have, I don't have now the numbers, but I think we have formed about 2,000 or 3,000 health professionals in the previous to the pandemic, because we have a break to like other things, but we are going to continue with this course.
Okay, thank you very much. And another question, maybe to Marianela, all this impressive working that you have been doing in Madrid region, do you think, I know that with COVID, all this work maybe has been a little bit hard in terms of implementation, but do you think that this work that you have been doing can be doing in other regions in Europe in terms of teaching other regions in Europe or in other countries, and can understand how you've been working in terms of this implementation in your area?
It's sure that Madrid is an example for the implementation of the program in Spain. We can see in advantage too that Spain has a mainly situation because we have the consensus previous to advantage in 2014, and I think in Spain, for example, there are some regions like Madrid that are an example. It's true, like Marianela has said that the pandemic outbreak have make more slow the progression, the implementation.
And the trend has changed. We have a good trend, but because of the pandemic, this trend has stricken, and then the indicators slow.
Well, but it's very important because they have data about that, and it's very important for us. And it's true that data obviously has come worse than previous to pandemic outbreak, but it's very important for the future because they have you have seen they have a very well constructed information system, and it's easy for you to obtain that data, no?
Yes, it's because we are evaluating for 10 years, not these indicators, but we evaluate other indicators the same way as this one. Then I think it could be easy to continue with the implementation. And in that moment, in the Community of Madrid, has been implementing a plan de mejora, an improved plan to improve the results of this service, and to attend these people, these elderly, these old people. That it is the important thing, not to improve the indicators or the results. The important thing is we have to attend this population.
So thank you very much. Time. It has been a great pleasure. Thank you again for all the audience, and I think it has been a really good session. And see you soon. Thank you very much.
Thank you. Thank you. Bye.
Thank you.